I remember polio. I remember it as a kid. It scared the hell out of us. Nobody knew what was happening. How a kid could wake up in the morning and go to school, look healthy as could be, and die before dinner. That's what polio was all about. Iron lungs, scary results, and crippling kids, and we didn't know where it came from. Every conscientious mom had a theory. My mom said playing in rainwater in a freshly fallen rain in our neighborhood was dangerous for polio. That was her interpretation. No one really knew. And then came the amazing news that someone had developed a vaccine to deal with polio. We couldn't believe it. No kid wants to take a shot, but to be protected from polio, you did it, and you were happy to do it. I did when I was a kid in the 1950s. And as a result of it, we brought polio under control in this country. A vaccine. Dr. Jonas Salk from Pittsburgh, a man I'll always revere because of the comfort that he brought to families who were concerned about polio. Can you believe, Mr. President, that we are now debating polio vaccine again in this country? That the nominee proposed by President Trump for the Health and Human Services Department has raised questions about the efficacy and safety of vaccines, including polio vaccine. This morning in the Chicago Sun-Times, a reporter named Neil Steinberg wrote an article about this issue. He quoted a statement that was made very recently by Katie Miller. She's the transition spokesperson for RFK Jr., Robert F. Kennedy Jr., who is President Trump's nominee for HHS, which has jurisdiction over many health agencies and certainly has a lion's share of responsibility when it comes to vaccines. Here's what Steinberg wrote. Mr. Kennedy believes the polio vaccine should be available to the public and thoroughly and properly studied, his spokesperson said. Thoroughly and properly studied. What a great idea. Let's look into it. How about taking 1,349,135 kids across America and submitting them to a blind trial at 244 different test areas around the country. Half will receive the cherry red vaccine and half a placebo or nothing. Then we can really find out, we can really study and see if this vaccine is any good, polio vaccine. Oh wait, that's exactly what we did. In the spring and summer of 1954, 70 years ago, and to this day, it's the largest medical experiment in the United States history. Thousands of doctors, nurses, principals, teachers, parents, and other volunteers banded together, working for free. The government wasn't paying them. That smacked of socialized medicine. Gosh, Neil Steinberg, you might ask, being yourself an inquisitive sort, just like me, why did thousands of doctors, nurses, principals, and others, supposedly with busy lives, drop everything to help run this giant medical test in America for no compensation? Possibly because polio was scything through the children more than 57,000 cases in 1952, with over 3,000 deaths. A child could be healthy at breakfast and dead by dinner. That catches the attention of neighbors and dials up public spiritedness. For RFK Jr. to say that we have to study polio vaccine at this point is not only sad, it's shocking. Shocking that a person is seeking the highest level cabinet position under the Trump administration and is willing to be so fast and loose with the scientific truth. 1,300,000 plus cases administering, testing it before we move forward with it. 70 years ago, nothing in the meantime to suggest it otherwise. It is safe and efficient and effective. And what about all the other vaccines? Polio is the one I'm focusing on today. What about all the other vaccines that have spared children measles and rubella and so many other diseases and problems that could be dangerous to them? Now we're going to debate those all over again in the 21st century because RFK Jr. has his own theories on vaccine. Listen, I'm ready to meet with RFK Jr. and ask him point blank what his position is. But I'll tell you this, if he is going to be the scourge against vaccinations across America, he's in for a fight. because what's going to happen, sadly, is a lot of innocent children and innocent people are going to be hurt as a result of it. Oh, incidentally, just before the 1954 test began, 1.3 million people, radio commentator Walter Winchell went on the air to warn the vaccine may be a killer and that the authorities were stockpiling little white coffins just in case. The next week, 10% of the kids pulled out of the experiment by worried parents. We've been through this before, and thank God cooler heads and smarter minds prevailed. If we have to go through it again, it's worth the fight. I ask consent that this article be submitted and part of the congressional record.
Without objection.
I yield the floor.